First, in today's health headlines, the importance of culinary medicine teaching for medical residents. Childhood vaccination rates have dropped again, and why weather changes impact how you feel. All great topics. Joining us this morning, Dr. Arjun Venkatesh, Chair of Emergency Medicine for Yale School of Medicine and Yale Medicine. Doctor, first of all, thank you so much for your time today. It's great to see you. Good morning.
Good morning. Thanks for having me.
It's great to have you. And a recent study found hands-on cooking culinary medicine classes actually increased resident physicians' nutrition knowledge. This is obviously important. Can you talk to us about this?
Yeah, it was a fun and important study that came out from some Yale School of Medicine researchers where they did a randomized trial, meaning they took all the medical residents who were training in primary care. Half of them watched videos about diet and health and how food could help people's health, and the other half got hands-on training in a test kitchen. And here's what they found. Both groups learned a lot and could answer test questions about how food was medicine, but the group that got the hands-on training in the test kitchen was more likely to engage their patients on how to use diet to improve their health around diabetes or other chronic diseases, and more likely to consult and engage dietitians in their care. Oh. And so I think we know that food is medicine. This is the kind of study that teaches us how we need to train the next generation of doctors to make that reality.
Yeah, sounds like it's a different kind of learning when it's hands-on. It makes sense. It really does. The childhood vaccination rate has dropped again as non-medical exemptions spike. What should we know about this?
You know, this has been a problem ever since 2020 and the start of the COVID pandemic, which was after years and years of kindergarten vaccination rates. So these are kids entering kindergarten having well over the 95% expected vaccination rate. We've dropped down, and now we've hit a new all-time low below 93% for important diseases like measles and whooping cough. The thing that we have to recognize is that there's a lot of misinformation out there. And parents need to make sure they're getting the right science. They should be talking to their pediatricians, looking at the recommendations from organizations like the American Academy of Pediatrics that have been very clear that the science hasn't changed on this at all. Vaccines are just as important today as they were before the pandemic, if not even more important, and to make sure you get your kids vaccinated.
Yeah, all very timely in this back to school season. A lot of people making those appointments. And we've all heard someone say that they can feel an incoming storm in their bones or even have a migraine from it. This is always so interesting. Is it true that weather can really impact how you feel like that?
So my grandma used to always say to me that she could feel the rain coming or that her bones felt some new weather. And I used to laugh at her even as a medical student. I have to admit I was wrong. The science increasingly shows that when there are changes in barometric pressure, particularly amongst all, and we know certainly other things in weather too, that it actually can change how pain receptors on our skin feel. It can change how we feel things like osteoarthritis in our knees and our hips. And so it actually can be something where your body could feel it more. You may be more prone to getting a migraine headache when there's changes in barometric pressure. We're still learning a lot about it, but I think the important thing for people to know is if you know that certain things are triggers for you, just like extra screen time and less sleep, that you do a good job of managing and preventing your symptoms as you would for any of those things.
That is so interesting. I found myself researching that. When you hear people say, you know, their knees hurt when something's coming, it's also interesting. All right, Dr. Arjun Venkatesh, Chair of Emergency Medicine for Yale School of Medicine. Thank you so much for your time today. Also interesting. Appreciate it.
Thank you.